Yes, it is in the daily newspaper today that the Southwest governors don't make face mask compulsory for everyone. So still obeying and complying with the directives from government. You can see the way we will take come on top health matter. Simply because now the show be this, we go enlighten you, tell you more, informate you on everything where you need to know about health-related issues. Not only that, the trending pandemic, which is COVID-19. So on that, I say good morning, wherever you watch us from. Chief Oludodo Naim be my name. And as you know, we have Dr. Bartolomeo Ufegbunam, the MD, CEO, Grace Valley Medical Center. Good morning, sir.
Yeah, good morning, Chief.
How you doing, sir?
Yeah, happy to be back.
Yes, sir.
Good morning, viewers at home and around the world. We're happy to be back today on Health Matter and WAP TV. Today, we'll be continuing with the discussion we started some few months ago, and that is coronavirus pandemic. Coronavirus pandemic. Those of us who were still awake as of yesterday night, at about 10 p.m. precisely, we saw the latest release concerning the affectation that has to do with us, Nigerians. A total of 51 new cases were said to have been discovered in the last 24 hours. And that is quite a huge number considering what we have been seeing in Nigeria before now. I think the last we saw was 35, and all of a sudden, we are seeing 51 new cases in Nigeria. And I think about 32 of them actually happened in Lagos. And of course, we do know that Lagos is the epicenter for Nigeria. That said, I just want to quickly look at the global affectation of this deadly contagion. Also in the last 24 hours, in the US, for instance, about 2,535 persons were said to have died. 2,535 individuals lost their lives in the US in the last 24 hours. That number is alarming. That number is frightening. It's outrageous. And of course, we also do know that in the US, it has affected more than 700,000 people. Precisely 709,735 persons have been affected in the US. Over 700,000 people have been affected in the US. And of course, on a global scale, 2.2 million people, over 2.2 million people have been affected globally, causing more than 154,000 deaths. That is quite high. And in the whole of Africa, our data has gone beyond 1,000. Before now, South Africa was the worst hit in Africa, but I think Egypt has gone above South Africa. With a few numbers, Egypt at the moment has about 2,844 individuals that are affected by this scourge. And of course, you have South Africa coming close to Egypt with 2,783 persons. Okay? Next to them is Morocco, also above 2,000, 2,564. Algeria too, 2,408. And of course, our nearest neighbor here, Cameroon, is almost hitting 1,000. 996 persons have been affected in Cameroon. And that brings us down to Tunisia, 864, and of course, Nigeria, 493. 7 less than 500. It is not good at all. It is not good at all. And this brings me to the advice that we gave last week. We are pleading, we are begging with all Nigerians to please obey the directives that are coming from the federal government, that have cascaded down the state government. I'm happy with the level of response we are seeing from the federal level down to the state government. A number of states have made it compulsory for everybody to put on face masks. And I'm going to explain to you shortly why it is so. Now, coronaviruses generally have been causing disease in humans for several decades. But a good number of them were simply causing diseases like common colds, which oftentimes are mild. But a few of them have actually caused severe outbreaks of some deadly diseases in the last decade, two can easily come to mind: SARS, as well as Middle East Respiratory Syndrome, MERS. That actually happened. SARS, of course, happened in 2002, 2003, and then MERS happened in 2012 in Arabian Peninsula. Yes, they were deadly, but not to this extent. As a matter of fact, for SARS, for instance, every one person was actually dying among 10 affected individuals. So it was a lot more severe than COVID-19 that we have at the moment. And of course, that enabled the authorities at that time to quickly isolate such individuals because they were very sick. They were sicker than what we are seeing now, okay? Talking about the majority. So it was easier for them to quickly isolate these individuals who were quite sick. But we have a different ball game with COVID-19. Of course, I want to also point out that the disease has officially been named COVID-19. The virus that causes COVID-19 has officially been called SARS-CoV-2. Okay, so what happens is that majority of individuals that get affected by this COVID-19, more than 80% of them will show little or no symptoms. So they don't even know that they're affected. And because of that, they can easily transmit the disease from one person to another without even knowing that they're distributing it. We have also heard about the so-called asymptomatic carriers and pre-symptomatic carriers. How is this possible? I want to go a little bit medical so that we can understand how this happens. Now, what happens is that these viruses are usually found, okay, in the droplets that usually come out of our mouth when we speak, or when we sneeze, and when we cough. Okay? Now, these droplets, some of them are so small that the particles are retained in the atmosphere, in the air, for quite some time. What happens is that when we inhale such particles, they get into our throat, they get into our larynx. And our larynx, our throat and larynx, the coverings of the throat and larynx have a large number of receptors that are called ACE2 receptors. Now, these ACE2 receptors are usually the avenue through which the virus gets into our system. So these viruses are already primed in such a way that they can lock onto this set of receptors, which are majorly found within the linings of the throat and the larynx. So once they lock up with the receptors in the human cells, the RNA that these viruses contain can easily go into the cells. And when they get into the cells, they get into the inner part of the cell and affect the replication mechanism of the cells, in the sense that they become, they copy themselves, as in they make copies, several copies of these same viruses. One could enter, and before you know it, it turns into millions of viruses, which eventually will burst open the cells, and of course, will begin to move, transmitted to every other part of the body via the bloodstream. What happens? The body system does not fold its hands and just watch. So the body system will mount an immune reaction that oftentimes, in most cases, is able to halt the spread of this disease. So this is what happens in 80% of persons. So when the body system mounts an immune response because of this foreign offending agent that has come into the system, the body system is able to mount an immune reaction that quickly contains these viruses. And this can happen in people whose immunity system are very robust. Not so for the elderly. Not so for people who have coexisting comorbidities like diabetes, hypertension, asthma, and a number of them. So what happens is that when the immune system is able to respond this way and curtails the spread of the viruses within the cells, the person may recover over a period of time, with or without hospitalization. But in some few people, this may not be the case. The virus can track down the throat and the larynx, all the way down to the lungs, where you also have a large number of ACE2 receptors in the cells lining the lungs. And the body system, in trying to combat this offending agent that has been identified, the immune system of such an individual will go into overdrive, thereby attracting a number of other cells, okay, that come into play, that get into the picture in a bid for the body system to combat this. And that will on its own generate inflammation within the lungs. Okay, so this inflammation that has been generated is actually what gives rise to the so-called viral pneumonia. So such a person will require a ventilator to survive. Such a person will need to be put on a ventilator. But why does this happen in some people and do not happen in some others? It's still a matter of research. People can actually, the scientific community cannot give exact explanation behind all of this. There's actually what is called cytokine storm. Okay, now cyto is a Greek word that means cells, while kino is a Greek word that means movement. This cytokine storm that happens within the cell will generate more inflammation in such a way that the person is unable to breathe on his own. So such a person will have to be on oxygen. From oxygen, he may graduate to getting into being put on a ventilator, and of course, ICU care will be required. That was actually about the picture that Boris Johnson was into. Yeah. But thankfully, he was able to survive the disease. Okay, so this is how it invades our system, and of course, ravage the human system, of course, and the person begins to struggle. So a lot of people that are critically affected may not actually survive. But keep in mind that 80% of people that are affected will survive with or without, or with just minimal treatment, just like the Commissioner of Health had said some time ago. Because people were asking, why is it that the cases we are seeing in Nigeria, a number of them have been discharged? It's a good news. We are doing very well. I must point that out. Okay? But he also pointed out that a good number of them were kept away from the community, were isolated, quickly isolated, to curtail further spread of the disease. So if you're asked to stay at home, there is a reason why the government is asking us to stay at home. If you're asked to wash your hands regularly, if you're asked to use sanitizers in situations where you're unable to wash your hands, if you're asked to do social distancing, which of course, in a layman's way, or physical distancing, it must be 2 arms length away from one another. Okay, so we should make sure that we ensure that we do all of this to stay protected. Putting on face mask, we dwelled on that largely last week. In the course of the program, we show about 2 videos. Of course, how to wear the normal conventional face masks. You don't need to go looking for medical face masks, just like what we have here. All you need to do, if you can't lay hands on this, you don't have any excuse whatsoever. You can actually make one yourself. You can get a cloth. It can be a cloth face mask that is permissible as well. In the U.S., what the U.S. CDC has actually advised is for people to wear face clothes. Leave out the medical graded ones for medical workers, because at the moment they are in short supply all over the world. It's difficult for medical workers to lay hands on them. Just ensure that you have something that covers your nose and your mouth. And that will help us to limit the spread. Now that we are beginning to have community spread, every hospital in Nigeria is at the moment a front line for COVID-19. And I must tell you the reason. These patients can present in any hospital, because the truth of the matter is that the individuals concerned, themselves, they do not have an idea that they're incubating or that they've been infected. So they can present in any hospital.
So that's why you must be prepared as a doctor.
You must be prepared at all times. As a doctor, you must have a high index of suspicion. That is not debatable. Anybody that is presenting with respiratory symptoms, that should alarm you. That will make you to start thinking, could this be? As a matter of fact, we are even advising now that any case that has respiratory symptoms should be, until otherwise proven, you should be thinking of COVID-19. It's important to do so, because that's the only way we can promptly isolate these individuals so that they can get to a place where they can get adequate care and then recover over time.
Okay, Dr. Matta, thank you very much for that lovely medical literature you've just delivered. Most definitely, we will go on this break. And when we're back, we'll open the phone lines so that anything where they do your mind, yaga, as far as COVID-19, they're concerned, you go feel ask. Plus the ones where we self get here to make sure we both enlighten ourselves and stay safe. So go nowhere, stay safe. We will be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
Wet your hands with water. Apply soap. Rub your hands palm to palm and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub. And then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
Putting on N95 3N1860. Perform hand hygiene before putting on mask. Choose the correct size of the mask and ensure there are no defects. Hold the N95 in your palm with the nosepiece at fingertips. Hang head straps freely below hand. Position the N95 under your chin with the nosepiece up. While holding the N95 in place, pull the top strap over your head so it rests high on the back of your head. Pull the bottom strap over your head and position it around your neck, below your ears. If you have long hair, the strap must be positioned beneath your hair. Untwist the straps. Position the N95 low on your nose. Using both hands, mold the nosepiece to the shape of your nose by pushing downward and outward, while moving your fingertips down both sides of the nosepiece. Perform a fit check by placing both hands completely over the mask. Be careful not to disturb the position and exhale sharply. If air leaks around your nose, adjust the nosepiece as described in Step 5. If air leaks at the mask edges, adjust the straps back along the sides of your head. Perform fit check again if an adjustment is made. Wear the right size mask. Fit check is mandatory for all users of N95 mask and must be performed every time upon wearing. Perform hand hygiene after putting on mask. Pull bottom strap overhead. Maintain the hold on the first strap. Use another hand to pull the top strap overhead. Do not touch front surface of mask. It should be kept in a new clean Ziploc bag for reuse and discarded at end of day unless wet or soiled. Perform hand hygiene after removal of mask and after putting on the reused mask.
Yes, you are welcome back to the show Health Matter with Dr. Bat. And I said a lot before we went on the break. Most definitely, we know you have a lot of questions you want to ask too. Please feel free. Join us as you take note. The show now Talk Your Own. We talk our own. We discuss the coronavirus pandemic vis-a-vis the phone lines. Go the show for the screen now so that you go fit. Yeah, that's it there. Fit call, chook mouth. First and foremost, turn down the volume we do for your television so that we'll go hear ourselves very well. Maybe I should take the first shot while we expect questions from you. And the very first shot will be Dr. Bat. What are the glimpses of hope we have so far now from researchers? We don't hear more about the disease. Everybody don't know about this disease. We know the name, we know the symptoms and everything. But so far, is there light at the end of this dark tunnel? What are the researchers saying vis-a-vis vaccine? Because the latest I heard was that Israel said they will come maybe June or July. I don't know. Please, you as a doctor, help us.
Thank you very much. Thank you very much for that question.
You're welcome.
It is not all doom and gloom for the world. of course, there are positive signs. And I want to start by saying that having mentioned that over 2.2 million people have been affected on a global scale, let me also quickly point out that so far, 574,450 persons have actually recovered from this contagion. 574,450 persons have recovered fully from this contagion. So I will start from that point. Second one is that at the moment, there are a number of ongoing clinical trials for a number of drugs. WHO, sometime last month, declared a mega trial that has a number of drugs, about 4 of them. The commonest one that a good number of us can easily remember is the hydroxychloroquine, okay, and chloroquine phosphate, okay. Also, there's a drug that came out about 4 years ago, a very popular one. It was meant to be a drug for Ebola, Remdesivir. Okay. At the moment, it's topping the list, going by the, I think a number of the trials are getting more positive results from Remdesivir than anyone else. Okay, so that's a glimmer of hope coming from that angle. What about vaccine? Over 80 different vaccine makers are racing to get a vaccine for this contagion, for COVID-19.
Okay, sir. Let's quickly take Efe from Edo. Good morning, Efe. The doctor is here.
Okay, good morning.
Good morning, Efe.
Please, I would like to know how many days does it take to react, this coronavirus in the body? How many days does it take to react?
Thank you very much. Officially, the incubation period has been put to 2 to 14 days.
Please turn down the volume on your TV set so that you
okay, so officially, the incubation period has been put at 2 to 14 days. What that means is that, from the time someone picks up the disease to when it begins to show some signs and manifestation. Okay, so that's the incubation period. That accounts for the reason why people who are exposed, when the government is talking about doing contact tracing, once you have an individual testing positive, you need to look around the person to see the number of people such a person have come in contact with in the last couple of days or weeks. Okay, and then those people will be quickly isolated. They will be asked to be on self-isolation for a period of 14 days, meaning that those of them who may have the disease may actually start manifesting within this period of time. After 14 days, if there are nothing happening to them, they are assumed to be okay. Thank you very much for that question.
Okay, Dr. Matta, I've been around your hospital for the last over a week now. We see every day. And one of these days, I saw NCDC agents in your hospital, which you actually came down to attend to them. The question now is, what is really happening? The Minister of Health made it clear that private hospitals should not attend to or should not treat COVID-19 agents. What's your reaction to this, knowing full well that most of us, we go to private hospitals first? How do you react to this, sir?
Thank you very much. Thank you very much. Let me make a correction first. Yes, it was true that some people came visiting, but they were not NCDC officials.
Okay.
They
claim to be anyways?
No. They came from Lagos State government.
Okay.
What is beginning to happen now in Lagos State, for those of us who live in Lagos, is that Lagos State has actually gone a step further ahead of a lot of other states. They are now moving to hospitals to go and ask hospitals questions about the number of persons you have come in contact with in the last couple of weeks or days. Okay, so what happened that they came around, they asked us for the people who have presented with some certain symptoms.
Okay.
And then they asked us to give them the list. We brought the case note and supplied the names as well as the phone numbers. And of course, they reached out to those individuals.
Sorry, sir. Bilikisu from...
We'll come to the question.
Sorry, sir. Yes, sir.
Yeah.
I'll note it. Bilikisu, how are you doing?
Hello, good morning, sir.
Good morning, my dear. Good morning.
Yes, sir. Yes, sir. Sir, the question I want to ask is, the number of people that have this virus, is it that they are not resulting it from the COVID people? Is it that they are not resulting it from the virus? Because it's getting high, and there is no reduction.
Okay, thank you very much.
The mathematical analysis now.
Yes, thank you very much. Your question is a very good one, I must point it out. As a matter of fact, it's just for the statistics. For instance, I looked at the the model for Lagos State reporting this morning, I discovered that Lagos State will display the number of people that are currently affected. They will display the number of people that have been discharged. They will display the number of people that have died.
Yes.
And then they also display the number of people that were transferred out of Lagos. I think three individuals, 3 persons were actually transferred out of Lagos.
To where,
okay,
sir?
but maybe to some other states.
Yes, okay.
Okay, so I'm talking about the... Okay, so we have something similar in our front. You can see the number of discharge, 159. And our question is, why is 159 not subtracted from 493? Okay, so that's the question. For the statistics, so that there won't be error of mathematical calculation and everything.
Omission.
That is why I think the authorities allowed it to be so. Okay, so the numbers are usually not deducted. Comfort from...
Taraba, good morning, Comfort.
Good morning, sir. Doctor, how was sir?
Fine, thank you.
Please, I want to ask, can that COVID-19 be reoccurred in a patient that has been discharged?
Thank you very much. Very good question. I think I got a question similar to that last week. Can it reoccur? It's still a matter of research. Okay, but what we do now at the moment was the fact that a number of people who apparently tested negative after they were discharged, not in Nigeria though, about 81 of them were reported to have tested positive again.
Wow. Wow.
Okay, so like I said, like I always say, this is an uncharted territory. There are still a whole lot of unknowns about this disease. A whole lot have not been known about this disease. It does appear that it is not going in the typical fashion that we knew virus or viral causing infections to be before now. Okay, but a whole lot of research are still ongoing. Thank you very much for that question.
Okay, sir, you're on the contact tracing.
Now, coming back to what you talked about. Now, because of the existence of community transmission, okay, Lagos State government has taken it a notch higher by visiting facilities. A number of houses would have been visited within this period of time. They come around, Lagos State COVID-19 team. Okay. They will introduce themselves politely. They will ask you the number of people you have seen in the last couple of days. They will mention specific symptoms and you supply the particulars and the names of those patients. They will be checked out in their homes. I think Abuja is also doing something like that, okay, that led to the discovery of, I think, about 9 or 6 cases. I'm not so sure, but I'm sure of that of Lagos. So it wasn't NCDC officials that came.
Lagos State Emergency.
Lagos State COVID-19 team. Wonderful job there from the governor.
Okay, so let's take George from Sokoto. Good morning, George.
Good morning. Please, I want to know the difference between quarantine and isolation. That's number one.
Okay, the difference between quarantine and vaccine.
No, isolation.
Okay, isolation.
Quarantine and isolation.
Thank you very much.
Then secondly, I want to know the immune boosters, because it's as if everything depends on the immune system of the patient. So I want to really know what we'll be doing to boost our immunity.
Thank you very much. Thank you very much. Quarantine and isolation, the are 2 English words usually used interchangeably when we are talking about removing people or taking people away from their natural environment, okay, or their home.
Their habitat.
If you can use that word. Okay, so, but in quarantine, what that means is that you're taken completely away. You're kept in a place, okay? Unlike isolation, sometimes we ask people to self-isolate. Okay, so that's actually what Nigeria has been doing at the moment. If you're discovered to have had undue contact with anybody who have tested positive, you are not usually kept in quarantine. You're asked to self-isolate. What that means is that you take yourself away from every member of your family, remain in a place for people who can afford that, because sometimes...
Because yeah, some governors did.
Yes, yes. So you take yourself away from the... a number of government officials have done that. For instance, the NCDC Director General, when he came back from... he went for a program in China, in the heat of the epidemics in China. Okay, so when he came back, he stayed away from work.
For 14 days.
He self-isolation for 14 days. That's different from quarantine. But quarantine, usually, sometimes we'll add mandatory quarantine. You don't have power to escape. Once you're kept in quarantine, you must be there. But that is not so for isolation. Thank you very much.
Okay, Dr. Bat, moving on, yes, we have to still talk about women. I'm talking about pregnant women now. We know that once a woman is pregnant, their immune system, I stand to be corrected, but they are very delicate. That's the word I'm trying to use now. They are in a very sensitive period. Sir, what is your advice for them at this period? Because they will have to go out for clinic and a whole lot of things they are doing vis-a-vis their health, which is very trembling. Let me use that word.
Thank you very much for pointing out that. Usually, pregnancy comes with a number of baggages. For some women, their PCV will start dropping. Okay, so they
What's
need to
PVC,
be
sir?
Blood level.
Okay,
Thank
sir.
you for calling me back
Okay.
on that. So they will need to be put on some form of hematinics, blood supplementation drugs or medication that they will start taking to enable them to maintain their blood level and a number of other nutrients that the body will require at that time. The part B of the last caller's question, please
That's
remind me.
immune booster.
Yes,
I have
immune
it, sir.
boosters. Okay, so there are no advice or advices for pregnant women that are different from the general advice that we give to everybody. Number one, you must maintain social distancing, very important.
Sorry,
Isaac
sir.
from Lagos.
Isaac. Good morning, Isaac. Good morning, Isaac.
Morning.
Yeah, Isaac, you need to be a bit audible.
Yes, this is Victor Francis. I'm calling from Jaconde Estate.
Okay, from Jack on the estate. Oh, yeah, go on with your question.
Yes, what I want to complain is that they say we will stay indoors. Then they will share some things for us. But since where this is start, we never see anything for Jaconde lately.
Okay, Isaac, that has been noted, and I can guarantee you that appropriate authorities are watching WAP TV, and they will definitely do something about that. Basically, Health Matter is for us to face the health challenges of COVID-19. So the socio-political aspects, I'm sure they are watching. People in Jack on the estate said they've not gotten palliatives, they've not gotten relief materials. So government authorities watching, please help do something about that. So
yeah, I'm sure Lagos State government is they are planning something for Lagosians. I think I listened to the governor some few days ago talking about that. So in no distant time, it will get to everybody.
we're talking about immune booster now.
Okay, so immune boosters. I want to say that there's a lot that I've seen people talking to me on a number of things that they've been doing on personal levels. A number of families have taken to some form of supplementation, if I might use that word. Some say they drink ginger water mixed with some other stuffs. They ensure that every member of the family drinks it every morning. Yeah, you must drink it if you're a member of such family.
Ginger is an immune booster?
My brother, it has been debunked to be a myth. It does not boost any immunity.
What of vitamin C, sir?
Yes, vitamin C is one of the vitamins we have around. It serves as antioxidant in the body. It helps to mop up free radicals. It gives a number of health benefits, okay? And also, of course, it helps to boost immunity. Unlike the one I talked about, the ginger and what other one.
A question, sir. Vitamin C, does it have anything to do with the white blood cells that fight diseases?
The white blood cells that fight diseases are part of the component of an individual's immunity system. Okay. So directly or indirectly, anything that boosts someone's immunity will help along that regard.
So vitamin C is even better than the garlic we are drinking?
As a matter of fact, the vitamin C itself have been used in some parts of China in the treatment of COVID-19 patients with good success. Okay, but I want to believe it may be one of the drugs that are undergoing clinical trials at the moment.
Wow.
When given in high doses, intravenous, not in tablets. Okay, they said it helped to improve the lung function of people who are on ventilators and life support that have this disease. In some parts of China, it's documented.
And we are all looking down on vitamin C and glorifying garlic and ginger.
So instead of taking to some other things that have a number of other people will say drink plenty of water and all whatnot and all whatnot. All of those ones have been debunked. Some say hot water very early in the morning and water view.
Okay, let's take Lotana from Federal Capital Territory. Good morning, Lotana.
Good morning, doctor.
Good morning, my brother. How are you today?
I'm fine, and you?
Pretty good.
Okay, my question goes like this. We're told that the virus is not curable, but that the symptoms are what that they treat.
You have to take that again so that we'll be able to know what to nod our heads to. Take that again, please.
I said, my question is, we're told that the virus or the COVID-19 cannot be cured, that there's no drug for curing it.
Okay.
Yeah, that is correct. Go ahead, sir. So what's the question?
Okay. So, and now many people recover from it due to, we're told they treat the symptoms, maybe the cough, the flu, and whatever, and they recover from it.
Okay. So, well,
what did they use to treat it? I think that's the other.
Okay, thank you very much.
Since it has no cure.
At the beginning of today's program, I actually pointed out what happens. I try to paint a clinical picture of what goes on when an individual is affected or is infected. I will take that again. Now, 80% of individuals, over 80% of individuals that may pick up this infection may actually not come down with severe disease. They may not get hospitalized. They will recover on their own.
Self-limiting.
With, yes, for some viral infection, though, thank you very much, sir. With or without treatment, that is a clinical fact. Okay? Now, what happens in those individuals that are able to do, that made them able to recover? I tried to explain that at the beginning. And I said that there are ACE2 receptors that usually line the covering, the inner covering of the throat, as well as the larynx, and also the lungs. So you have them in large numbers, which is actually the receptors that this virus usually attacks, thereby releasing their RNA into the cells of the body. Now, when that happens, such a person's immunity, or for some individuals, the immune system is able to mount and challenge the infective agent or the pathogen. And when that happens, the immunity system in some situations is able to curtail further damage to the cells. And of course, such persons will recover with or without, with minimal symptoms, with or without hospitalization. But some other people, it may be a different ball game. Okay, so it progresses to the extent that the viruses are able to track down all the way down to the lungs of such an individual, where you equally have the presence of these receptors that we talked about. And the body system tries to mount a response to it, thereby going into an overdrive. Now, when that happens, when it goes into overdrive, a complex mechanism or reaction will take place that will bring about the production of inflammation of tissues around the place, thereby occluding the airway in such a way that such a person will now need assistance to be able to breathe, either by way of oxygen supplementation or by putting such an individual on ventilator. Okay, so that is what happens in that case. Some people will recover, while some others will not. The others who may not recover, that may require hospitalization, sometimes in intensive care units, are usually less than 20%. But a good number of them will recover.
I won't let you go without this question. The issue of sanitizer. The issue of sanitizer. Some people have seen some very funny sanitizers these days. Some very sticky. Some I don't even know the content of. Sir, my question now is, before we go, is it advisable to play safe with a good mentholated spirit, or can we roll with any sanitizer? You agree with me? You quite agree with that? There are some funny sanitizers out there.
Yes, as a matter of fact, a lot of people have actually gone into making of sanitizer. A lot of people have actually gone into that.
Which I question.
A good sanitizer should have at least 65 to 70% alcohol. Percentage of alcohol
65 to
70%, nothing less than that.
Okay.
Some say 70% of alcohol. Okay, if you can't lay hands on sanitizer, spirit can equally serve. But what we advise in most cases, to wash one's hand with soap and water, under running water for about 20 seconds. We'll see you again next week.
Thank you very much. Take care. We love you.